Hi, my dear friends. It's my honor to be here to share some Chinese experiences about the hexpot frames. And my name is Hui Du. I'm coming from Beijing Jishidang Hospital. And today my topic will be using the hexpot frame to perform the osteotomies around the knee. And of my hexapod frames are to do is to around the knee osteotomies. And you can see it's 9 o'clock in Beijing, 9 p.m. I'm still working now, mainly due to this case. Today is a very busy day of surgery. And this is a young lady of osteogenesis imperfecta with a huge deformity of the tibia. And we can also use the hexapod frame to correct, but in this case is only to control the rotation and to compress the osteotomy site. The main job is using the rush pin, and you can see that is the model. We can use the rush pin to correct the deformity, and using the hexapod frame to compress the osteotomy site and control the rotation of the limb. And now I will start to talk about the basic theories of the standard hexapod unit. And the most widely used in the world is the Taylor spatial frame TSF from the Smith and Nephew, and also we also have the TL hex from the Orthofix, and so Double Medical has its own hexapod frame. It's very useful and with its own software. And the basic theory of the hexapod frame is that nearly all of the hexapod is based on this dual platform, and it is using the two planes to control the two fragments of the bone, and also using the 6 struts which can adjust independently to correct any deformity in the spatial frame. And this is the Charles Taylor to modify from the Elizarov circular frame. And this is the 3 different generations of the struts. And this is close view of the struts. You can see in the TSF, it's a double crocheted universal joint, which can allow the struts to rotate in any direction. And usually, any kind of the configuration of the Elizarov frame, you can use the one set of the hexapod frame to correct. And to me, I think the traditional Elizarov frame is more like professional camera. You have to adjust the light and do everything well before you take the photo. But the TSF is more like this. A simple digital camera. You can just press to take the shot, then you can use the computer software to adjust your photo. And this is a very severe equinovarus deformity. It is a 3-dimensional deformity. You can use one set of frame to correct the deformity, again, gradually in around nearly 2 months. And usually if you want to correct the deformity, you have to tell, after you put on the frame, you have to tell the computer 4 things so that the computer can calculate the correction. The first thing is what's the deformity like? That is the deformity parameters. Usually we will use our software or use our ruler to measure, which is the basic skills of the surgeons. And the second thing is you have to tell the computer the diameter of the two rings and also the length of the 6 struts. And the third thing is where is the frame? That is very important. But usually if we have some error, usually it's due to this part. And in this part, and also we have to put in some mounting parameters usually is where the frame away from your cora or apex. And the last thing is how soon do you want to correct, and this is the to prevent we injure some structure, for example the common peroneal nerve or the regeneration. And let me show you something about why is the mounting parameter is very important, because why is the computer need to know where is the frame? Because you can see in this frame, if we put the frame, the rings, reference ring, one is low, one is high above. The difference is only the proximal, the axial offset. Then you will see we can see the frame is a little bit different. Usually it's at the height of the frame is different. But usually if you put on the different medial or lateral offset, then it only will interfere with the frame with the the distance of the two rings. But usually the angle is the same. But if you put in the two different lateral offset, usually is not related to the coronal deformity. You can see the frame is still the same. And last, if you put in different rotation parameter, usually the frame will be totally different. So usually if we have some error of the correction, usually it's due to this part. So that is my way to measure the mounting parameters, usually using the intensifier. And that is the 4 parameters. And why I use the intensifier, because usually you have this kind of special angle. You can be perpendicular to your reference ring. It's very difficult for you to do this in the radiology department. And after that, you can put in the software that is easy. You tell the software the deformity parameters, then the mounting parameters, and the 4 different parameters of the reference ring relatively to the cora or the apex. Then at first the frame is like this. At last, after the correction, the frame will look very beautiful. And that is where is the structure at risk. You don't want to jeopardize that structure, so you put in the speed, and the software will tell you how many days you will have to correct this deformity. That is the program. And let me share with you some of my cases. This is my early cases of nearly the first 5 cases, which is very good for the start of the hexpop frame. It is a genuvarium deformity, and together with the leg length discrepancy. Then we can use in the one set of the Taylor special frame to perform the osteotomy. We can use the jigsaw, or also can use the multiple drill hole. And for this case, I use the jigsaw, and you can see it's healed quite well. And also the leg length discrepancy is disappeared. And the second case is genovalgum deformity, and due to the physical injury, the childhood, and also there's compensatory tibial varus deformity. So for the mild varus deformity of the tibia, usually I will using the plate to correct acutely. For the deformity of the distal femur, I can use this hexapod frame to correct it gradually. Then you can see the X-ray. You can use the plate to do an open wedge osteotomy of the tibia and to correct the MPTA and also using the hexball frame to correct the deformity of the distal femur and correct leg length. But for this kind of surgery, usually you will be very careful about the pin site. Usually it's very, sometimes it's very painful for the patient to do the knee exercise for the rehab. So you have to tell the patient to do the rehabilitation very, you will need to tell the patient if you don't do the exercise, usually will end up with a very stiff knee. The third case is a young lady complained of the leg length discrepancy of 4 centimeters, and also there's some on the deformity analysis we can find there is external rotation of the bilateral tibia, and also there's valgus deformity of the distal tibia, and also some varus deformity of the proximal tibia. So there's 4 problems for this young lady. How can we treat that? We can using the vertical double level hexapod frames to correct the 4 problems. We can correct the 2 problems on the proximal tibia, which is the leg length discrepancy and also the varus proximal tibia. And we can correct the other 2 problems, which is the valgus ankle and also the rotation deformity, the external rotation of the tibia at the distal tibia. We can use separately 2 sets of Taylor special frame to do that. You can find at last the patient will have equal leg length, and also the rotation of the tibia is good, and also the perpendicular of the joint line of the proximal and distal tibia to the mechanical axis. And this is the 4th case, which is a very severe geniovarum deformity of the Blount's disease, and also together with the valgus deformity of the distal tibia. And we can find during the operation, you can find the patient have very instability on the medial side. The medial collateral ligament is very unstable. So we can, that is due to the depression of the medial tibial plateau. So we can correct that problem. You can see this is the depression of the medial tibial plateau. We can, to correct this problem using the intra-articular osteotomy, and we can correct this using the 2 cancellous bone screws, and also together with some synthetic bone graft. And at last, we can use the hexapod frame to do the metaphyseal osteotomy to correct the residual varus deformity of this patient. This intra-articular osteotomy is similar to the TCVO, but the fragment is a little bit small. But at last, after that, I usually do the intra-articular osteotomy, usually using the TCVO, the method. Usually I was using a very big bone segment so that I can grab the bone fragment using only the Taylor special frame. So I don't need to use the this screws to catch the bone fragment. And you can see after the operation, the varus deformity already correct half. Then the residual varus deformity gradually using the Taylor special frame, and also correct the valgus ankle. This is the left side. And at last, the patient have a very good alignment. And the five case is a 50-year-old lady complaint of the medial joint space pain due to the malunion of the proximal femur 30 years ago. And we can correct this deformity maybe using the antegrade IM nail, but sometimes it may be difficult to control the alignment from the antegrade IM nail for this patient. So I use the telespatial frame to correct the deformity during the operation. You can see this is to find the Cara, then I put on a frame. This is the perpendicular to the axis. Then I start to measure the mounting parameters. This is the AP, this is the lateral view. Then at last, I using the software to calculate, then I correct the deformity acutely. After that, I will using the intensifier to find whether it is good enough. I want to translate the proximal side medially, so I run the second time the program. Then I will and then I'm using the frame to medialize the proximal bone fragments. Then after that, I think my alignment is good enough, so I compress the osteotomy side using the frame, using the TSF frame. Then after that, I change the frame into an internal fixator, which is a locking plate. You can find using the near, far principle. Then I will change the external fixator into an internal fixator, which is very convenient for the lady. So that is the X-ray after that. 1 year, the bone healed very fine. And the patient, there's no joint lines pain at the medial side of the knee joint. That is the alignment. And the sixth case, and this recently, I'm using the software to pre-assemble the frame, just like the lateral frame. For example, this is a young lady complaint of the leg length discrepancy and also the valgus deformity of the left femur. And we can using the software to calculate what kind of frame we want to use. We can choose the different diameter and also the 6 struts of the length of the 6 struts. Then we can using the software to pre-assemble this frame. Then during the operation, we can only use 2 steps. One is we use the intensifier to put one cushional wire first. Then we attach the frame distally to this K-wire. Then and the proximal part, you can use 1/2 pin. You can see the first step, the second step. Then you have already fixed the frame on the bone. So it's very quick. Usually it's less than half an hour. You can finish the operation, and the patient can bend the knee very freely. This is the after the operation, the leg length is totally corrected, and also the valgus deformity. So this kind of pre-assembled the frame convenient for the surgeon to minimize the time, the length of the surgery. And the last, can we do this in double level? And also the answer is yes, we can use. This is the frame from Double Medical. And we can use the software to put the double level hexapod frame before the operation. Then during the surgery, you can put 1 K-wire approximately, 1 distally. Then you can fix the frame to the leg. Then you can use another 20 minutes to finish the half pins. Then using 10 minutes to do the osteotomy. So the double level osteotomy with the hexball frame, usually less than 40 minutes. It's very quick and very good. You can find the post-op X-ray. Yes, that's the very good result. And that's my sharing of the hexball frames. Thank you.